Hi all, welcome to this video. For those of you who don't know, I'm Lauren-Jane. I'm a junior doctor and I'm a mother and I'm trying to balance everything. And this week I'm going to be talking about a breast lump that I've got because I think many of you know, like, you're trying to achieve all of these incredible things, but health really doesn't care about that. It doesn't care who you are, it doesn't care how much money you've got or how busy you are, and it doesn't really care how old you are either. And so I've been living my life just going about things as normal, going to work, looking after the kids, having Christmas, going out and about, and just doing things as normal. And I had found this lump, and this week I'm going to get it checked because I really should have done as soon as I found it, and you need to too.
So my GP was wonderful. They got me in the same day, but I'm on a 2-week wait pathway. I guess what I was waiting for was for someone to just say, it's fine, it doesn't need seeing, don't worry about this. But that isn't what they've said, and I'm on a 2-week wait pathway, and I'm grateful for that. But yeah, it's really worrying because I work with women who've had breast cancer, all the time, especially on call, so it's really scary. So today is breast cancer appointment day. I've been waiting for this appointment for about a week and a half. So I found a lump in my breast about 6 to 8 weeks ago, and boys and girls, you need to know this. Boys, you need to know this for the women in your life, and girls, you need to know this. My lump is not in my breast. So the breast, you obviously know where the breast is. There is an axillary tail of the breast which goes up like this. Now my lump is not in the breast itself, it's here in this tissue. So we always teach people, whenever you check your breast, you don't just check the breast, you check under the armpit and you check in the axillary tail, which sits on top of the breast, just like this. And this is where my lump is. So I found this lump a while ago, and because it's so close to my armpit and it's been Christmas, you can probably hear I'm still like really blocked up. I've had virus after virus. I thought probably it's just raised lymph nodes and hopefully it'll go away. And honestly, I never thought that this would be me, but I was just really frightened and I was putting off going. And do not do that. If you feel a lump, you go straight to the doctor. And eventually, about a week and a half ago, I noticed that I think there's more than one lump. I would describe it as being gravelly. So I went to see the GP, and I just wanted to walk in there and her do the whole, exam and just go, it's fine, go home, go away, it's fine. And she didn't do that. And that was what I was afraid of. And she has put me on I'm on the cancer pathway, which here in the UK means that I have to be seen for an assessment within 2 weeks. And that is absolutely the right thing to do. So today is the day I've been waiting for, so I'm going to go to the Breast Institute. These lumps are going to get scanned. She actually found more, so she found one on the other side as well. There's a cluster on the right and there's one on the left, and likely it's nothing. I hope it's nothing, but I am really, really worried. I'm really worried, and I'm going to share this with you because you need to know, especially as we're always all getting older, aren't we? And for boys as well as girls, you need to know, for the ladies in your life, if they get a lump, they go straight away. I'm in hand clinic today. I'm not off. My work had been very, very good. I've got the afternoon off to go over to the other hospital that I work at, to the Breast Institute, to have the lump checked, and they'll probably biopsy it as well, which sounds like fun. I'll take you with me and we'll go through it all together. But I'm in hand clinic this morning, so I am working. I'm trying to stay really positive. My general rule of being a doctor is always your patient is having a worse day with you than you are. So I always try and stay like mega cheerful. But in fairness, today I'm in hand clinic. I might be actually the one who's having the worst day, but I'm going to stay smiling. I'm going to serve my patients. And this afternoon, Ash is going to come and pick me up, and he's going to take me over to the Breast Institute, and I will take you with me, and hopefully it's all fine.
It was hard. When I was at work, I was able to focus on the patients, but it was in these moments between patients where my head went to places that it just shouldn't have gone, like, what will my children do without me and all of that.
2 p.m, back from work. I'm going to get changed because if you're going to have to sit topless, you probably don't want to be doing that in a dress. I'm really nervous. It's really good for me as a doctor to go through this patient journey, although, to be honest, I feel like I've always had loads of empathy for my patients, but oh God, I am just I wouldn't even use the word nervous, like actually really scared.
Same hospital, which I usually work at, and I'm now a patient here. I've put on some brightly coloured lipstick to try and make myself feel more positive, and Ash is here, he's gone to pay for the car, he's here somewhere, and we just got to get through the door and do it. So I was super nervous in the waiting room because there's lots of other women in there. You all look really nervous. You're all waiting for the same thing. But I just kept telling myself, you're here. You're going to get your answers. So you get popped in a room with a nurse practitioner, and she does a breast examination, just you and her and whoever's with you for support. And then you get moved through for an ultrasound. So it should be a triple assessment. The first bit is the assessment, then the ultrasound, then the biopsy. Because my ultrasound was okay, the doctor just came in and reassured me, and I didn't have a biopsy. So it was all good, brilliant process.
So it's all good news. I had the ultrasound scan. It was fine, in and out, dignity the whole time, covered as much as possible. It's lymph nodes on both sides, which is what I thought it was initially. But it's always the best thing to go and get checked because you just never know. And my GP found a lump on the other side, which I'd never even felt. And so the important thing is that someone is checking your breasts, and I'm all right. And I'm so glad that I went and did the process. So if you have a lump or you know someone's got a lump, make sure they go and get sorted.
So I always say that it's just so important to make sure that you've got a job that you want to get out of bed for in the morning. But honestly, I cannot stress to you enough how bloody horrible it has been getting up in the morning. It's so cold, it's so damp and so wet. And it has been difficult to get myself to work so early in the morning. It's like dark when I get there, it's dark when I leave. But I do love my job. I really love burns and plastics. It's a really varied medical specialty. Burns can be really, really devastating in terms of what they do to your body, and I work in a centre where we do see big burns, and most people are okay, and that's good, but there's a lot that we need to do to help them, like skin grafting, and we also do things like we look after hands, and we can also we help patients who've had breast cancer. So when I'm not doing that, obviously, you know, I'm with my family, I love my clothes, and I'm really trying to find some balance. I've done a lot this week. We went on holiday. You'll see some footage of that in a minute. And I also did some interviewing at my 12-year-old school, which was super awesome, and it made me really reflect on interviewing. And I'm going to make a video and share some of the tips that I shared with those kids, because those kids were awesome. They were really confident. So yeah, I've been out. We had a work night out. I got some new boots. Look at these. These are the least surgeony shoes I've ever seen in my life, and I'm obsessed with them. I think as a doctor, you really need to have an identity outside of the hospital because it can be really difficult. So we did manage to get to Centre Parks. That was awesome. We went with my sister and my brother-in-law and their children, and that felt like a million miles away from some of the things that I have to do at work. So apart from the breast stuff, it's been a really positive week, and I got to wear some really cool outfits, and we got some great family time, which is what's really important to me. Because obviously, you know, children just, you know, get so big so quick. So yeah, that's my sister there in her pajamas, just in the white. And this is me when I was interviewing, and I can't wait to share with you some of the things that I reflected on. There were some really great kids there. So I've done some really awesome stuff this week. To all my new followers, please let me know what you want from these videos, what you want to see, what questions you want me to answer. And I'm just so grateful to have you all here. I've come in now at 2,500 subs, and I'm just so happy, so grateful. So thank you all so much.